Suzanne, you ready to go? All right. Good morning, everyone. My name is Vinny DeMarco. I'm the president of the Maryland Healthcare for All Coalition. We're here today with a very, very important announcement, which is that the public strongly supports healthcare, including Medicaid, for Marylanders, and wants our state legislature and governor to do everything they can, as they have been doing, to make healthcare affordable for Marylanders. In particular, they support a policy to deny tax deductions to drug corporations for their commercials, so that we could use the $24 million that would be saved every year, sponsored by Senator Karen Lewis Young, and House Bill 484, sponsored by Delegate Natalie Ziegler. So I'm going to start today by introducing my partner in this effort, Nikki Heisman-Vernick with Horizon Foundation, who will talk a little bit about the importance of healthcare, and then we'll turn to actually releasing the poll to you. Nikki?
Good morning. Again, my name is Nikki Heisman-Vernick, and I'm president and CEO of the Horizon Foundation. We're the largest independent health foundation in Maryland and a proud partner of Maryland Healthcare for All. We're happy to jointly sponsor this poll alongside Vinny and the coalition. I'm going to talk a little bit about Medicaid. Medicaid is a life-saving health insurance program that provides coverage for 1.5 lower-income Marylanders. And 85% of Marylanders, Maryland voters see Medicaid as being important in their local community. That's nearly 9 out of 10 voters. 9 out of 10 voters can agree. Right now we can't agree on a lot of things, but we can agree of the importance of Medicaid. And in just a few months, new rules coming down from the federal government will force at least 320,000 Marylanders to reapply for Medicaid every 6 months. Half of these individuals, almost 160,000 people, are likely to need help with the required documentation to reapply for Medicaid every 6 months. Our local health departments are not currently staffed to help this many people keep their coverage, especially when they need help every 6 months. So imagine this, right? A sold-out M&T Bank Stadium holds 71,000 people. Imagine if 4.5 stadiums of sold-out people showed up at your door every 6 months to get healthcare coverage. And almost half of them need real assistance to maintain that vital health insurance. Talk about long wait times. If we add 100 healthcare workers, we can help 160,000 Marylanders keep their health coverage. So unless the Maryland General Assembly takes action this year, it's likely that 160,000 current enrollees, many of them our Black and brown neighbors, will lose coverage. We need action now. Our state senators and delegates need to fund health department workers across the state. And this poll that we're about to release shows overwhelming bipartisan support across the state for doing so. 76% of Maryland voters support added funding for the healthcare workers in this budget, and that is across political parties. So let's preserve Medicaid, let's preserve access to healthcare, and let's get this done. We have a voter-approved way to pay for this. We're so excited to see enthusiastic support for SB 987, a smart bill that will provide the funding needed to help people get coverage that they need, either through Medicaid or through the Maryland Health Exchange. So everybody needs to tell their state senator and delegate, we need 100 healthcare workers for 160,000 people to keep their Medicaid coverage. We've made great progress in this state, and we must not go backwards now. Thank you.
Thank you. Thank you very much. That was very eloquent. Now we know the problem. Now we have the solution. And I'm now going to introduce Steve Robbie from OpinionWorks, who's going to talk about this new poll that we're releasing right now that shows overwhelming support both for the Medicaid program, for health coverage, and for denying tax deduction to Big Pharma to pay for these programs. So Steve Robbie, all yours. One of the best pollsters in the whole nation.
Thank you, Vinny. Thank you. Good morning. My name is Steve Robbie. I'm the president of the independent, nonpartisan research firm OpinionWorks. We are based in Annapolis, and we're in our 25th year, examining public perceptions for government agencies, nonprofit organizations, and foundations coast to coast, and the news media. I'm here to briefly share with you the results of the new representative statewide poll of 824 registered voters, which was conducted March 7 through 11. So it's brand new. The results of this poll are clear and they are emphatic. And here they are. First, voters want the state to act. Nearly 9 out of 10 voters believe that, quote, the state of Maryland should play a role in helping control healthcare costs and making sure that Marylanders have access to the healthcare coverage they need. Second, there is a near consensus that Medicaid is important and needs to be protected, as Nikki said. 85% of poll respondents said that Medicaid is important for people in their own local communities all across the state. Most of those, amounting to about 60% of all Maryland voters, feel that Medicaid is, quote, very important. Couple that finding with the 65% of Maryland voters, roughly 2/3, who oppose the federal legislation passed last summer that could result in thousands of Marylanders losing Medicaid coverage. This vast reservoir of support among Marylanders for healthcare access and affordability translates into very strong support for 2 legislative proposals that we tested in the poll. In the first of those, a very large majority, or 76% of Maryland voters, support a proposal to, quote, fund 100 additional county health workers to assist people with their Medicaid applications and the paperwork they need to submit to keep their health insurance coverage. Only 15% of voters across the state oppose that idea. Separately, in a test of SB 987 and its House counterpart, we found that 73% of voters support and only a tiny 7% of voters statewide oppose this proposal, which would remove the tax deduction for pharmaceutical ads, with the additional tax revenue dedicated to, quote, support Medicaid and fund subsidies to make healthcare more accessible for lower income Marylanders. I just want to emphasize that the voter support for this measure is 10-1, an absolutely overwhelming level of support. For both of these measures, support is bipartisan and it reaches all corners of the state, as detailed in our poll memo. As a closing thought, I'd like to offer this brief context. We have always seen in our Maryland polling a concern for neighbors and a desire for public policy that lifts up and supports people who need that. What we're seeing today in this poll, though, is an electorate that is expressing an unusual urgency about those concerns at some of the highest levels that I have ever seen in my career, which translates into overwhelming support for the type of legislation we're discussing today.
Thank you. Thank you. I would welcome our former City Council President, Lawrence Bell. You want to stand up here with us? Come on.
Sure. Honored.
Thank you. Thank you, Mr. Bell. So I thank you, Steve. This poll shows the public wants this done. And we all benefit. As Comptroller Brooke Learman says, we all do better when we all do better. When we reduce uninsured rate from 13% to 6% in Maryland, we insured 400,000 people, but we reduced uncompensated care by over $460 million. If we go backwards, that uncompensated care will go up, and so will our insurance premiums. So we all do better if we pass this law and keep health care in place. Now we want to hear from Bobby Laughlin, who will tell you a personal story of the importance of this law in his life. Bobby?
Hello, my name is Bobby Laughlin. I work 2 jobs, neither of which provide insurance, so I rely on Maryland Healthcare Connection to purchase health insurance. At the beginning of the year, I almost lost my health insurance when Congress failed to extend the enhanced premium tax credits. My monthly payment was set to quintuple and I wasn't sure how I'd be able to afford coverage. Thankfully, the state-based subsidy program was passed and ensured that my payments would stay the same, but only for 1 year. In less than a year's time, I, along with tens of thousands of other Marylanders, will again be in jeopardy of losing access to quality, affordable health insurance. That is why it is so important to pass bills like SB 987, which would fund new resources to continue providing Marylanders with access to health care. Without legislation like this, I will be forced to go without insurance or downgrade to a plan that barely meets my needs. If I am hurt in an accident or suffer a serious illness, I will be bankrupted. I will lose access to visiting specialists and, most importantly, access to preventative care that has in the past allowed me to stay on top of problems like high blood pressure and cholesterol before they become big issues. Access to quality, affordable health insurance is not only important for the enrollees, It has significant economic benefits for Maryland. By providing affordable healthcare to young and low-income adults, we can help to reduce the overall cost of healthcare in the state. This leads to a healthier workforce, reduced absenteeism, and increased productivity.
Thank you.
Thanks.
Thank you very, very much. As you heard from Bobby, if this law doesn't pass, House Bill 987, House Bill 484, Senate Bill 987, and if we don't get this $24 million a year from denying tax deductions for pharmaceutical ads, people like Bobby will lose their health insurance, and we will all suffer. We need to pass this law. And one of the main reasons we've made the progress we've made is because of a lot of support from organizations like 1199 SEIU. We're thrilled that Lorraine Haricott from 1199 SEIU is here to join us.
Thank you so much, Vinny. We are so excited to stand up here with this strong coalition and support this bill. My name is Lorraine Haricott, Senior Policy Analyst with 1199 SEIU. We're the largest healthcare workers union in the nation, representing over 10,000 healthcare workers across the care continuum here in Maryland, D.C. That is hospitals, nursing homes, federally qualified health centers. We support this bill because at a time when our country and our state are facing devastating healthcare cuts and funding deficits, this bill provides a common sense solution to protecting health coverage in our state. Our healthcare workers know firsthand the impacts. They're the ones that are feeling the burden of a broken healthcare system, especially now as patients are losing health coverage, they're receiving delayed care, and return to the hospitals and health facilities with serious and expensive complications to our hospital systems, to a system that is already understaffed and overburdened. Higher numbers of uninsured patients, together with likely benefits and lower payment rates for hospitals, nursing homes, and other health facilities, will ultimately lead to job cuts that impact healthcare workers and a lower quality of care for the care that they can provide. This legislation is transformational in protecting access to health coverage and investing in our healthcare workforce. We cannot, Big Pharma's advertising tax breaks cost taxpayers an estimate of $1 billion per year. Money that would be much better spent expanding health coverage and access rather than padding the pockets of these corporations. It's time we start holding Big Pharma accountable and investing in lower healthcare costs for our consumers. This legislation meets the moment and ensures that we are investing in a healthier state and ensures that every Marylander has health coverage. Thank you so much.
And of course, we would have not made any of our progress over the years without the faith community of Maryland. And we're in a faith institution right now. The Episcopal Diocese of Maryland is hosting us. And we're thrilled that Reverend Ken Phelps of the Maryland Episcopal Public Policy Network is here to talk with us about the faith community's support for this.
Yes, thank you, Vinny. I am the Reverend Ken Phelps Jr. I do serve, as Vinny said, with our Public Policy Network representing the Episcopal Diocese of Maryland. And it is fitting that we are here. The Episcopal Church believes that health care is a human right, which means that it should be universally accessible, it should be high quality, but most of all, it should be affordable. Vinny knows I like to say, Jesus gave this stuff away, folks. Gave it away. But in this country, we have a habit of monetizing those basic human rights. And the obscene profits of Big Pharma, of private insurers, are legendary. This bill represents, for us, a chance for us to begin another small step to righting that wrong, to leveling the playing field. To making healthcare even, for this percentage of the population, to be more affordable, to give them the care that they need. We are in crisis in this country, and it is our duty as people of goodwill, people of faith, to be sure that our neighbors are cared for. Our founder, Jesus, tells a story at the end of the Gospel of Matthew, where the nations line up to be judged. And they're not judged about their power and wealth and strength. They're not judged by what they believe. They are judged about how well they cared for the least of these, welcoming the stranger, caring, bringing comfort and healing to the sick. This is our moral duty. Thank you.
Thank you, Reverend Elsa, moving story and conversation with us. And whenever we have one of these events, we close with one of my favorite faith leaders, a leader, the president of the Ministers Conference, Night Ministers Conference of Baltimore and vicinity, who is an eloquent spokesperson for healthcare for all, Reverend Sandra Connor.
Good morning, everyone.
Good morning.
Good morning. Good morning. I'm glad to be here today, and I'm so glad that all those of you who are in front of me have spoken so eloquently about the costs, the issues that you face in your various locations and spaces. But I thank you, past my previous person who spoke about what Jesus said, the moral factor that we're dealing with. Everything that we deal and should be considered a moral factor. Everything that we do should be given consideration that someone is hurting as a result of what we do and what we don't do. Everything we do ought to be considered about being equitable, ought to be considered about being fair, being just, being right. Because somebody suffers when we're not considering the things that make things just and make things right. So today I stand before you representing various faith leaders, not only in the Baptist entity, but also various persons. So part of our coalition for Healthcare for All, those who've been with us, who've been signing on. If you know, you don't know, don't realize that we as faith leaders are considered those persons who are trusted and valued. We're the ones who often get the call to say that I can't afford this and I can't afford that. We're the ones that may get the call that says my high costs for my living expenses are bad because I can't make it. So anytime there's an imposition or any additional cost factor that's put on one of our congregants or our members, it affects us as well. Our desire is that everybody should have a good living environment in more ways than one, socially, mentally, spiritually, as well as economically. Our desire is that everyone should have an opportunity to be able to do those things free and have not having all kinds of limitations and things that are imposed on them because of things as the bill that we're looking at right now, against the bill that we're looking at right now. But we ask that you all consider going along and favoring this bill and doing whatever needs to be done, because we believe that we as faith leaders are going to do all that we can do to continue. Make sure that our constituents, our members, get what they need. We make sure in more ways than one. And I'm seeing that more and more there's a desire for us to make sure that members are being healthy, that members are being able to get what they need and to go forward. We're seeing more and more that people care. It goes way back for me when I first came on board with this team, when we were doing our Maryland Faith Health Network. I had to put a plug in for that. Because back then we were concerned about how faith leaders got together with their members to make sure they went into the hospital, but they also came out of the hospital and that they did not go back. When we begin cut costs and when we begin to withhold things, you're going to have more people go into the hospital. You're going to have more people go into the emergency ward. You're going to be the ones that's going to feel it yourselves because that cost is that additional cost is put on. We're already feeling now how members come and say, did you know my premium went up? And we haven't even gotten to the part that we're talking about right now. So I encourage us all to do all that we can to make a difference, to do something about it, to see something, say something, and be an advocate for not only healthcare, but everything that makes a person whole. Everything that Jesus, as he said, or whoever your leader is, your God may be, will have you to do things just and right. Thank you all for being here. And I want to put a plug in. We have healthcareforall.com. We encourage you to go there. We're looking for opportunities to raise funding for our Healthcare for All initiatives that we're doing. One of the initiatives that we have on our website right now is our Renew initiative. We're hoping to raise funding for that to do things for other Medicaid or whatever health initiatives that we may have. We encourage you all to follow us on healthcareforall.com. Thank you.
Thank you, Reverend Connor. Very, very inspiring. Well, Maryland is lucky. Unlike other states, our governor and General Assembly have done a great job of expanding health care, but we're under attack from President Trump and H.R. 1 in Congress, and they want us to go backwards. This legislation, Senate Bill 987, House Bill 484, by denying Big Pharma tax breaks for their ads, would raise the $24 million, which would help prevent us from going backwards. Keep people on Medicaid and keep people's health insurance in place. People like Bobby will not lose their health insurance. And this poll that you heard about from Opinion Works shows that the people of Maryland overwhelmingly support this, and we hope the legislature will enact it and keep health care there for people. So that's it, and thank you very much. Any questions? Okay, all right, thank you.